Good morning, YouTube. It's your girl Coco. T is not with me. Um, but I decided to take y'all on a journey that most people wouldn't. Hold on, I'm begging out. I probably should have did this first. But I decided to take y'all on a journey with me. It's a serious journey. I'm setting myself up for surgery. It's a lot of steps I gotta take. To lead up to surgery. I was in the hospital a couple of weeks back, and I ended up being in and out of ICU for 14 days in the hospital. And once they finally figured out what was going on, now there are certain steps and tests I have to take in order to have this surgery that is much needed. I guess some people don't think about it. Like for me, what was going on, I actually have a crack in my skull. They don't know how I got it. They don't know if it was from pressure headaches or if it came from trauma and me not knowing. But the reason why we found this out is because every time I bend over to tie my shoe or just bend over to in church while they're praying or anything, my nose would run. Well, I'm just thinking I have bad sinus issues, and that was not the case. And so I want other people to be aware of this. I actually had a crack in my skull, and it's at the top part of my sinus area. And what is happening is we all have fluid around our brain, and what is happening every time I bend over, the fluid from my brain is leaking through my nostril. So I had to collect some fluid, and that's kind of nasty. But anyways, and from the cerebral fluid to make sure it's actually cerebral fluid. Then I have to follow with a brain surgeon. It's a lot of little steps, but I just want to take y'all on this journey so people can be aware, because this leaking has been going on for years with me, and I'm just thinking that I have a bad case of sinuses. So we look forward to you all following us on this journey. So this YouTube may be a little longer due to the fact of the journey. So anyway, thank y'all for subscribing, liking our channel. Peace. And we are headed to my pre-op appointment. Remember, I told y'all I'd keep y'all on my journey. So what's going on is I have a pseudo tumor that normally comes from trauma or different kind of things. But anyway, my pseudo tumor ended up causing a crack in my skull. Over time, I had been leaking fluid from my nose and didn't know why. And remember last time I showed y'all the fluid that they was testing. So it did test positive for cerebral fluid, which means brain fluid has been leaking from my nose. So now I have to have a series of surgeries. So today we're going for pre-op. So they're going to, so what happened is from the pseudo tumor, it caused it's a pressure headache, and it caused a crack in my skull, which I had been leaking the fluid from my nose to relieve the pressure. So now they have to, and then from the pseudo tumor that caused the leak in the crack in my skull, it caused meningitis. So this all started from me having meningitis twice, and they didn't understand why. So now they have to try to go in and repair the crack in my skull through my nose, which they don't know if they can, because they're having a hard time locating where the crack is. So today I'm doing pre-op for testing, and what they're going to do is next week they're going to run some dye in me to try to find the crack in my skull.
All three of y'all wobblers. What's wrong with y'all? Y'all look like y'all about to fall out.
This is my side is hurting. I started hurting last night on the left side.
Your recovery is going to take a bit.
I see 3 months.
Yeah, it's going to take a little while. maybe not quite 3 months, but it'll take a little while, 8 weeks at least. So yeah, just be aware. Yeah, I mean it's not major. It's just that where we're doing the surgery requires a lot of. It's difficult to get to where we're trying to go. So it's a lot of having to get in there and move things around and get
or where it's bleeding from. But nothing. Yeah, that's the one thing that would have helped if they had found something there. Then we would have been able to say, oh, that's the spot for sure. So let me show you your CT scan. Just you stare. So I think this is where you're leaking from. So I think you've got a leak here high up on the left. There is the possibility that you're having a leak from back here. So we'll have to see when we get in there, and I think Dr. Franklin probably talked to you about doing the dye in your lumbar drain, so that they can dye the CSF, and we can then know for sure where it is. Yeah, but my bet would be that it's probably right up here. You can see right here your septum's crooked. Yeah. So your septum's the wall between two sides. Instead of going straight up and down, it kind of comes over to your left and back. I will likely end up needing to straighten that out to get up in there. You won't know the difference. This will all be on the inside of your nose. I would be taking tissue from off of there anyway to help reconstruct this most likely, and so I think
you're still getting past the surgery.
So your nose won't look any different coming out than it does going in. Unless something goes very wrong, your nose should look exactly the same. No one else should know that you've had surgery.
What causes that the nose is crooked like that?
Oh, it's just I should only work on the left side. And so, even if there's a good chance that your smell is less after surgery, because we're gonna put some new tissue up there and have to strip some of the old tissue, and that's where your smell nerves come from. You should have full smell on the right side. Afterwards, because we won't do anything. I'm not planning on doing anything on the right side, so I don't expect that we should in any way injure that. Certainly, it's a risk of the surgery, and I wouldn't be surprised if your smell was a little less good after the operation than it is going in. But I think that I think it's unlikely that you will lose smell.
Okay, I'll get
and the problem is taste is associated with most of taste is smell as well, so they go hand in hand. But I think you have to go in knowing that that's kind of the big risks, honestly, of this, with that infection, like meningitis you had, that you have recurrent issues, that you have to have something else done like the shunt, and this smell.
So how long will I be in the hospital?
You feel better now?
Yeah, I do. I feel better.
We got you.
I need some sleep.
It's good to see you.
You too. We'll see you next week. Leave it up to here and go listen on the journey. Yes. You on our way to the next part of the testing?
Yep. How you doing?
We're We're on our way to get some testing done. The doctor gave pretty good news.
Probably been working, but what I'm trying to say is, I'm overjoyed right now because I like the fact that he gave us good news. He said they won't have to go ear to ear because it's a strong possibility that the procedure that you got to go through is gonna light up to where they can go ahead and fix it through your nose instead of cutting you from ear to ear and messing up your, taking your skull out, getting inside the skull and find a leak and all that stuff.
That's what's great news. So we're on our way to go get the CTA scan so they can have some more definition of where the crack is actually in my skull. Yeah. And then we'll get some blood work and, pre-op testing. Yeah. And we'll be back next week for them to go through.
Yep, and then your 3-month recovery.
Yeah, he said it's a lengthy recovery, but it's not like, I can't go back to work.
Yeah, you can't go back to work.
And then they'll do the shunt. He said the shunts are real simple.
You want to go to the park and go walk?
Yeah, we can.
All right, take off running. Girl, you gonna pass out. You better stop.
Well, I'm a track star. You don't know. Man. You don't know. You don't know. Boy, you ain't ready.
Stop, Coco. You on the other side of the street now. You gonna fall in the street. Let me get on this side. Hey, let me tell you something. Men out there, when you're walking with your wives, always put them on the inner side away from the street. You walk on the other side near the street. You put them away from the street.
Yes, that's a good man. That's a good man.
Yeah.
Anyway, we'll be back when we go into the CT area. We're walking to the car.
So, yeah, same day, but a different doctor.
7 days until surgery.
Yep.
Man, I'm hungry. I'm hungry. I'm hungry. I'm hungry. I'm hungry. Hey, I'm hungry.
I need some chicken. I need some chicken. Now that you look at me like,
You need some chicken.
I need some chicken. Huh? I don't really eat chicken for real. Why?
See you on the 16. I'm like, she's supposed to know that.
What is your ENT's name?
Daniel Sachs. He's in the
Sachs?
Sarah.
Like SACKS?
He's on the Sarah Cannon building, and then Robert Franklin.
Girl, you would never know nothing wrong with you.
Running I'm pushing through.
My nose started wrong. Be like, yeah. No.
I know you sound like my mom, my dad. My nose.